A warning today from mental health specialists about some of the things contributing to suicide in this pandemic. Medical reporter Liz Bonis shares why there are new concerns today about the rise in eating disorders.
When a pandemic hits the country and we're fearful of its outcome, we all cope differently. Some people turn to excessive alcohol or other substances to dull the pain, others to compulsive behaviors that involve food.
We're seeing somewhere between 50 and 100% more cases presenting really at all levels of care compared to the same time last year. It really is a very dramatic surge.
Dr. Paul Hauser specializes in the treatment of eating disorders. A recent study in the International Journal of Eating Disorders shows what his team at Ohio's Lindner Center of Hope has already seen.
I think the number one thing driving it is anxiety and fear, which we're all experiencing right now. And I think that particularly for some folks that are predisposed that way, some kind of disruption in their relationship with food, either in the direction of overeating, what we would call binge eating disorder, or in the direction of restriction, which is often what we would call anorexia. It's one of the ways that we compensate mentally and emotionally when things feel out of control.
And that's one of the things he says we should know about eating disorders. They are not about eating. They are about a lack of control.
Absolutely. There's a lot more to it than that. A lot of times this is just one of the ways that our emotional struggles will manifest themselves.
Dr. Hauser suggests you talk to a primary care doctor if you're struggling emotionally right now and don't have a mental health counselor. Otherwise, he says this pandemic could pile on and add to the alarming number of suicides already linked to eating disorders.
Absolutely. Unfortunately, we do find a very high rate of suicide among patients struggling with eating disorders, among the highest of any mental illness.
I'm medical reporter Liz Bonis reporting.